When we see a cancer patient that's newly onset, it'll be about 200,000 to 300,000 white count. But these are all immature cells. They can't fight. This would be like sending millions and millions of toddlers overseas to fight in a war. It doesn't work. So there's times in the laboratory that it's pretty sad when you run it through an analyzer and you see 200,000 to 300,000 white count, and you're like, that's leukemia. And we help diagnose that for that patient. So there are some, some of the rare things that we see are kind of sad at times. Chemistry. So we have instruments, much like this, that cost $300,000 to $400,000 just for one instrument. And all the techs have to know how to work on that. It's highly computerized, so you have to know how to work the computer. But it's also like you're a part-time mechanic, because every day you have maintenance to do on it. You're cleaning probes, you're replacing fluids, you're doing tubes. Every week you have something different, and every month you have something different than that. So if your instrument goes down for whatever reason, maybe it breaks a probe, you're going to have to get out the wrenches, the toolkit, and you're going to have to put hands on and get this thing back to working again. So a lot of stuff that you do is like a part-time mechanic. For histology. Histology is anything of tissues. So, if anybody gets their tonsils removed, those things go to histology, to the lab, and then they get looked at. Breast cancer, tumors. So, if a woman finds out that she's got a lump, she goes to get a mammogram, then they schedule for a biopsy. A biopsy is just the process of surgically removing a piece of that, sending it to the laboratory, and then the lab will take that, we will make it in very thin slices, we'll throw a whole bunch of color to it on a slide and give it to the pathologist. The pathologist then can see, based on the tissue, whether that's cancerous or not. So this all happens in less than about a day or two. So as people come in for biopsies, we need to get those results back out to the physician so they can tell the patient's family whether that's breast cancer or not. So this is what it would look like on a slide. This would be normal breast tissue. And so he can look at, based on the tissue, he knows exactly what kind of specimen that is. Whether it's coming from breast or tonsils or colon or whatever it is, he can tell just by the slide. Blood bank. We do a lot of stuff with blood bank. Anybody know what blood type they are?
O positive.
You're O positive? Anybody know what the most prevalent is? A little louder. O positive is the number one. And then next is A positive. So that's about 70% of the population just with those two. So O positive is 37.4% and A positive 35.7%. Anybody have anything different than that?
I'm AB negative.
Really? 0.6%. 85% of this room is positive. 15% are negative. So if anybody knows what their blood type is and is positive, most likely that's the majority in here that's positive. We'll get more into this after a bit. We track a lot of different things by organs. Okay, so if you have a liver issue, we see liver enzymes, hepatitis. A lot of times patients come in with chest pain. We hope they come by squad. Some people drive themselves in with a heart attack. And then we can tell, based on those heart enzymes, if they're elevated, you're having an acute myocardial infarction. That's a heart attack. Then they go right into cath lab and get a stent put in. Glucose and kidney function tests. Those are all picked up on our chemistry analyzer. Meninges. Anybody know what meninges is? What part of the body is that? It's a little gap in the spinal cord. Goes up through the brain. So West Nile virus attacks that. You get meningitis. There's viral meningitis. There's bacterial meningitis, and it can be fatal. Urinary tract infections we help diagnose. Staph infections. And then we do acute like traumas. Somebody gets into a wreck out there, has a bleeding, surgicals. Triple A's are a big one with when you get a balloon in your aorta. If that ruptures, we go through lots of units of blood. And then cancer, we help with the diagnosis and the treatment of cancers, all different types. There's so much automation, so much computers in hospitals anymore. And trying to get them to talk together. So as soon as the patient gets registered, all that information has to come over through the laboratory. And all of the orders from the physicians come in and pressed electronically. We schedule patients using electronics. And then in the laboratory, we have our own computer system. Plus everything that's on our analyzers is all automated. And even my phlebotomists carry around a little PDA, a little handheld PDA. Wireless lead talks with our computer system, matches up with the patient's barcoded armband. And as we scan it, then all that information pops up. The phlebotomists know what to draw, they know who the patient is, and that helps us from drawing the wrong patient. It is extremely easy, if you're not careful, to draw the wrong patient, or to, once you draw that right patient, you label it up with somebody else's information, and then that patient gets the wrong results. So it's one of those things with the number of volume, you have to be extremely careful on what you're doing in the laboratory. So let's talk about some careers in here. So a phlebotomist is one of those people that would draw your blood. And every job in the laboratory requires at least a high school diploma. So if someone wanted to go on to college, has a high school diploma, and they want to get a job in the laboratory, part-time, drawing blood, you start out at about $10 an hour. I have folks that are accredited nationally as phlebotomists, that have been phlebotomists for 20 years, and they're making almost 19 bucks an hour. You're not going to get real rich working in the laboratory, especially as a phlebotomist. Phlebotomists have to be people person. They have to understand people. You can't have some rough, dude going out there with all these patients and not be able to understand what the patient's going through. And they have to work well with nursing staff, and they have to be able to speak clearly, because they are the face of the laboratory. Specimen processors sit in the laboratory, and they grab those samples that keep on coming in from the ED, from the floor. They're answering the phone, they're faxing results, they're pouring specimens off, they're transferring specimens out, spinning samples down, and getting them ready to go to the back. They just have to have a high school diploma, and they start out at about $10 an hour as well. Now, medical lab techs. These are folks that go to just an associate's degree. So it's a 2-year program. Lincoln has one at Southeast. And once you are completed that 2 years, you sit for a national board. Once you pass the national board, you can start out at $16 an hour. And then after, if you've been there, you can go all the way up to about 24 for a 2-year degree. I got a 4-year degree. And so you can start out with a bachelor's degree. Once you get through your 12-month clinical and sit for the national board, $21 an hour. But if you're there for quite some time and are very experienced, you can make about $38 an hour. That's pretty comfortable. We have histotechs over at our reference lab, and they have an associate's degree. They process all the tissue samples, all the tonsils, all the breast biopsies, all of the polyps and things like that come through. $21 an hour, and then $22 if you have a bachelor's degree for a histotech. Cytotechs, these are folks that will look at cells. They do a lot of pap smears. All those swabs will come in. They'll get those colored up, and you can tell whether you have any kind of abnormal cells. They start out at $25 an hour. So pretty much the majority of these, if you're going to make any kind of money, you're going to have to go and get a college degree. A pathologist, if anybody wants to be a doctor, these guys go through 4 years of undergrad. Then they get into medical school, and they have to do medical school for 4 years. Once they get out of medical school, they have to get into a pathology residency. That's another 4 years. So they have 12 years of school in order to look at everything that's in for histone. So they are one of the highest educated physicians that are out there. And here's some more pictures of the tissues that they would be looking at. Okay, so every year across the country, there's 13,000 jobs open. People are retiring. But with all the schools around the country, and Med Center only has one here, there's only 6,100 that are going to be graduating. So every year, there's thousands of jobs that are not being filled. So we're working short. My staff are working overtime, trying to get people in here. So, if you're interested in anything with science, or if you have anything that you think the lab might be an opportunity, or if you want to be a doctor, think about the laboratory. Even a nurse has to understand lab results, how to collect samples, what to collect, what order to collect, and how to interpret some of those results. So, in my laboratory, I've sent 2 on to medical school. I've sent probably 20 nurses. Everybody comes in, they know how to, they learn to draw blood, they process samples, something like that, while they're doing their undergrad, and then they get into nursing school. So I've graduated a lot of nurses out of my lab. And I've only got 2 people to stay in it to do lab techs. Most people that are phlebotomists either want to do other things like social work or nursing, and then sometimes they just stay on as phlebotomists. So it's hard to get them to go to tech school.